name is Dr. Dzifa Dey. I'm a consultant rheumatologist and physician specialist. I'm also senior lecturer at the University of Ghana Medical School. Autoimmune diseases are a group of diseases in which the immune system basically turns against itself and starts attacking it. Auto means self, and immune means your immune system. Your immune system is what is designed by God to protect you from foreign invaders or attack. For some people, the immune system gets confused and starts attacking itself. This happens because of a variety of ways. When you are being developed, your immune system is primed in such a way that it's able to recognize all the cells of the body as part of itself. For some people, however, there is some confusion with this because of various factors which we'll probably discuss in a little bit. And so they start recognizing certain parts of their body as being foreign. And as the immune system is designed, once it recognizes something as foreign, it has to attack it until it destroys you in its own way of protecting you. That is its primary function. But in this case, because of that mistake, it is attacking you and destroying you. That is autoimmune disease in a nutshell. It's a combination of factors, genetic factors, environmental factors, and as we mentioned earlier, immune dysfunction. These have to interlink for them to result in an autoimmune disease. Various autoimmune diseases have been discovered to have certain genetic markers, or the people who develop them tend to have certain genetic prototypes that predispose them to having an overactive autoimmune system, so to speak. Now, these genetic markers predispose you to various things, some of them to autoimmune diseases. Some may actually protect you from certain diseases, but that genetic makeup is what makes your immune system hyperactive. Now, autoimmune diseases, it's not just the genetic makeup alone that is what makes you develop the disease, because some people would have it and nothing happens. You need an environmental stimuli, something that comes to stimulate the immune system. And that's what varies for the different people. So different people, or some people may have the same gene, but they never develop an autoimmune disease because the stimuli never comes. The environmental stimuli differs. It could be stress for some people, hormonal factors, sunlight for people who have lupus, for example, can be a stressful factor. For some diseases, those who work in the petroleum industry, they postulated that those may be triggers. So there are various immune stimulants which vary for different people. And as we mentioned earlier, then your immune system has to have that propensity to want to be hyperactive or dysfunctional. And so a combination of those things results in an autoimmune disease. We have the localized type and then the systemic type. Localized meaning that the immune system attacks only one particular organ or system. So we have examples of the localized type as being things like type 1 diabetes, which you see in young children, thyroiditis, where people get inflammation of the thyroid gland. We have things like multiple sclerosis, where the immune system attacks the nerves in the central nervous system. So those are localized. And so the symptoms will be manifested as what happens when that particular organ or gland is dysfunctional. The systemic type is what we rheumatologists deal with mostly. Here, the immune system is not just focused on one organ, but can attack multiple organs. In fact, any organ or cell in the body that the immune system thinks is dysfunctional has the ability to be attacked. So they may have, people may have one organ like the eye being affected. People may have the heart, the kidney, the brain, all affected if it's a systemic type. And examples of the systemic type include diseases like systemic lupus erythematosus, known as lupus for short, rheumatoid arthritis, myositis of the various types, sarcoidosis, ankylosing spondylitis. There are different types of the systemic type of autoimmune diseases. Now, the symptoms for the systemic type also depend on which organ is affected. In general, however, if you take all the autoimmune diseases, some symptoms run through. and that is fatigue, extreme tiredness. Patients wake up and they tell you that they are not able to do anything even when they've rested. They feel like they've not slept. As one patient famously put it feels like you've woken up and you've been beaten by 100 witches in your sleep. There are joint pains which are common across a lot of them, especially the systemic type. So if you're having persistent joint pain, stiffness in the morning when you wake up, especially if it lasts more than 6 weeks, that should alert you that something might be going on. Fever, persistent fever, you've been treated for malaria several times, meanwhile they do not find the exact cause of it. You should suggest and inquire whether this is possibly an autoimmune disease. Unexplained weight loss, you are not trying to lose weight, the weight keeps dropping, especially if it comes with a fever and sweating, especially in the night. Those are the symptoms that are general and may cut across all the various autoimmune diseases. The rest depend on which organ is affected. So if it's the kidney, for example, you may have swelling of the feet or the face when you wake up in the morning, reduced urine output, that might alert you. So that if you have these symptoms, in addition to certain specific symptoms, you're losing weight, you have joint pains, you develop a rash, then you find it difficult to breathe. That may be because the immune system is attacking the organs. Now also, you have to also look at the age group to know whether this is a likely an autoimmune disease. So if you're a young person and you're having joint pains, young people don't get joint pains, so that should alert you quickly that there's something going on. If a young person gets a stroke, for example, it's important to investigate for some of these autoimmune diseases as well. Unfortunately, some people view autoimmune diseases as rich people's diseases because diagnosing and treatment can be pretty expensive, especially because a lot of the medications, unfortunately, are not on the National Health Insurance Scheme. So we're pleading with the authorities to ensure that patients have access to this. For those who have things like lupus or rheumatoid arthritis, our estimate that we did sometime last year saw that on average, those who have mild to moderate disease spend about 550 Ghana cedis every month on just medications alone. And for those who have more complicated disease that have renal involvement and other things, can spend as much as almost 6,000 Ghana cedis on medication alone. There are certain medications that they may need which are lifesavers that we call biologics. And that can cost up to even 20,000 Ghana cedis for patients if they need it at that point. For those who have rheumatoid arthritis, for example, so for biologics, they may spend about 4,000 to 8,000 cedis on infusions that they may have to take every 2 months for quite a long time, for years, just to get their disease under control. But we are talking even about just basic drugs that suppress the immune system, like prednisolone, which should be cheap and readily available on the National Health Insurance Scheme, but are not for these patients. Things like methotrexate, sulfasalazine, which are immunosuppressants, which can help reduce the cost for patients but are not on the National Health Insurance. If these are put on them, plus some basic labs, this will really, really help patients to be able to afford treatment. And as we said earlier, compliance to medications or treatment is the number one reason why patients may develop complications or damage to organs. And if we do not make it easy for them to be able to afford these drugs and have access to it, unfortunately, then we also contribute to their demise. The theme for this year is to make lupus visible. This is because a lot of these autoimmune diseases are invisible. People see the person and they do not recognize the amount of problems that the person is undergoing. Imagine that you have a kidney problem. It doesn't show outwardly, and so people don't tend to believe that patients have problems. Imagine you're having a cardiac problem, a young person. People do not believe that they have these diseases. You get up from sitting in a position for a few minutes, then you're not able to walk. People will be insulting them that, are you an old person? Why can you not walk? Just because the joints have stiffened up just for sitting for a brief period. These are some of the things that which patients undergo. Not forgetting the emotional and psychological burden of these diseases. and that kind of support is not provided to the patients, because people just look at the outward appearance and do not see the amount of trauma, turbulence, and emotional stress that these patients undergo. So we should all be kind and look at our patients, people who tell you they have these diseases, and try to support them in any way that you